o'clock in the morning and I might have to go to the hospital to get my GJ tube changed. A little valve, I think it is, where the extension connects to the J portion around the little disc is leaking really badly. And I have it rigged and taped up really weirdly. This is the first time I've actually had a tube break on me since 2013. I've had them flip back up into my stomach and all that, but I've never actually had one break. So this is a new one. We are back in the waiting area now. All checked in.
Just waiting to be called.
They're taking me back to interventional radiology, and I will see you guys in a few.
Alright, sister, let's hit the road.
How are you today?
I'm good.
So, what to expect during your GJ placement. Here they treat it like an actual surgery and a sterile procedure. Put a whole drape over you and sterilize your skin and all that, but in Florida, where I lived before, they did not do that. It was a quick in and out thing. They'll take you back to the room. They'll make you change into a gown. We'll be looking all stylish going back there. I do not get sedated for mine. They'll place a guide wire through the J hole in your old tube and then make sure it is properly in your intestines. They then take the syringe, take the water out of the balloon in the old tube, and then after they have the guide wire in place, and then they will pull the old tube out over that guide wire. That is the painful part of the whole process because sometimes the old tube the balloon doesn't deflate 100%. And so when you're trying to pull that bigger portion out of the stoma, it can feel kind of irritated. But other than that, the procedure itself is not that painful. And then they take the new tube and they feed it over that guide wire that the old tube was just pulled out under. And that is when they will put dye and then take an x-ray. Or in my case, they do air because I'm really allergic to the dye. One complication that normally can be a problem, especially for people like us with slow motility, is that when they're threading the J portion of the GJ into the jejunum, it gets stuck at the pylorus in the stomach, and then that J arm actually twists all around up in your stomach rather than going to where it needs to be. But a trick that I learned to get it down between all my NJ tubes and GJs is that thinking about food will actually make the process a lot quicker, and it'll go down because your body will think you're just trying to digest whatever it is. So every single time I think about an apple muffin with lots of cinnamon, like the kind from Perkins. I don't know if you all have Perkins wherever you're at. Do they even have Perkins around here?
Mm-mm.
Oh my goodness, I just realized that.
I've not seen any.
Oh man, they're apple.
Perkins.
They're muffins. They're so good. The cinnamon apple, it was like a strudel, and I'd eat that whole thing and put butter on it, lots of it. And then I would be so sick and wanting to die and telling you I was never going to eat again. So overall, the whole GJ change out is not that big of a deal, especially when you don't require anesthesia. It's really easy, and it is not as scary as everyone thinks it is. Unless there's unforeseen circumstances or your case is a little different with altered anatomy. But if it's any consolation, I actually do have altered anatomy because I've had a Nissen fundoplication, and they still usually get mine in rather painlessly. The tube change is done and over with. I'm not reacting too badly. It was really stressful because the nurses did not know, or the techs in radiology did not know what to use and what not to use because they were trying to use chlorhexidine, which I'm really allergic to. Then they wanted to use their betadine that I'm also allergic to because their betadine has extra ingredients other than just betadine. And I really don't understand why they think they have to even sterilize for a tube change, because it's not, the stomach is not a sterile thing. It's essentially equivalent to picking up a normal person picking up their sandwich and eating it.
I don't know about you guys, but I wear gloves when I pick up my sandwiches.
And so the stress from all of that, plus the gut manipulation and the extra perfume triggers.
Didn't smell any workers with perfume on today.
Yeah, that was really good, actually. I'm a bit reactive. I don't even know if I'm going to be able to walk a lot today.
Get in the hole.
Because once I get into a reactive state, you kind of just lose control of your muscles a little bit. And everything's all wobbly and tremoury and jerky. But it is done and over with, and now I don't have to think about it until another 5 or 6 months, or until the tube causes a problem.
Guess you probably needed to make sure that one works.
Well, they flushed it with water.
And you told them not to, right?
It was sterile water, supposedly. It is really hot in here. We're going home with a shiny new tubie.
I'm gonna live.